These cervical sinuses, they are remnant of the second, third and fourth cleft. Suppose it is persisting as two opening, correlation with surgery, then you will say the cervical fistula or branchial fistula or pharyngeal fistula. Sometimes the one end is obliterated but another end is persisting, then you will say the cervical sinus. Sometimes the both ends disappear but the central part persists, then you will say cervical cyst or branchial cyst or pharyngeal cyst. So these are the abnormality in the neck related with the pharyngeal cleft. Okay, now correlate with your radiology. Yes, can you see? If any patient is presenting with the cervical fistula, means two opening, means patient is eating the food or fluid, then through the two opening, from the inner opening inside the mouth and outer opening along the entry border of the sternocleidomastoid, the food will come outside. Then you are doing the radiological examination. You are inserting the needle and injecting the dye, radio opaque dye. So can you see the pathway is traced and the dye is coming up to the mouth. Okay, and you can see the dye is reaching up to the mouth. The taste of the dye may be felt by the patient. If the both sides are open and taste is felt by the patient, then it is the cervical fistula. But sometimes the dye is only at one part and the taste is not felt at the mouth, then cervical sinus. And sometimes, yes, can you see, only mass is visible along the entry border of the sternocleidomastoid, then you will say this is the cervical cyst. So this is the correlation of the embryology and the anatomy with your radiology as well as with your surgery. Yes, you will require the treatment according to the severity of the disease. Surgery may be needed. Okay, so now after this cleft part, now we are going to talk about the pouch. Okay, so again come to the same diagram. Yes, can you see the endodermal outbulging between the two cleft, endodermal outbulging between the two cleft, yellow color is presenting the pouch. Yes, can you see here, this yellow color is the endoderm. So this is the first pouch, here is the second pouch, this is the third pouch which is developing into the dorsal and the ventral part, and the fourth pouch is developing into the dorsal and ventral part. Okay, so can you see the first endodermal pouch, it is making the one tube like structure. This is the tube like structure and this is the cavity. So this is known as a tubo and this cavity is related with the ear, middle ear cavity. So this is known as a tubotympanic recess. Okay, so first arch gives rise to the tubotympanic recess. Tubo means tube. Which tube is located here? Auditory tube. And which cavity is located here? Tympanic cavity. So this middle ear cavity and auditory tube is derivative of the first pouch. While can you see this is the second pouch? Later we will see it will form the structure inside the oral cavity, that is a palatine tonsil, inner lining only. While this is the third pouch which is giving rise to the dorsal part and the ventral part. Yes, the dorsal part it forms the parathyroid 3, while the ventral part it forms the thymus. We will see one by one, and this is the dorsal part and the ventral part of the fourth pouch. The dorsal part it will form the parathyroid 4, while the ventral part it disappear, or few authors says that it participate in the formation of the lateral thyroid. Okay, so these are the facts, but are you getting? You are looking the pharyngeal cavity from the inside and you are looking the inner side structure. So what are the inner side structure? Yes, auditory tube opening, middle ear cavity, palatine tonsil. Yes, there is a parathyroid gland, thymus, these all the structures. Okay, so now we are going to see this structure in the developed way. Yes, can you see this is the first pouch, second pouch. Can you see the cervical sinus is very small and later it disappear. Okay, and this is the dorsal part and the ventral part, and here dorsal and the ventral parts. Okay, so what I want to tell you about the pouch. Okay, what you have to write down? These are endodermal outbulging, where in between two arches, or you can say in between the two mesoderm. What you have to remember, that this pouch are endodermal in origin. MCQ. Now see how many pouches are persisting, because there are the 5 arches, that's why 4 pouches persist. So this is the another MCQ. Now see how many pouches there are, first, second, third and the fourth pouch. Yes, first pouch, according to that image, it gives rise to the one tube and one cavity. That's why what is the name? Yes, it gives rise to the tubo-tympanic recess. So tubo means which tube is located inside the mouth, inside the pharynx part. Your answer is auditory tube and tympanic recess. Which recess is located here? Yes, definitely your answer is the ear related cavity, that is the middle ear cavity. If MCQ is asked that auditory tube is lined by which type of the epithelium, which type of the germ cell layer, ectoderm, endoderm and mesoderm. So can you see here? Yes, because it is the auditory tube which is getting developed by the pouch, and pouch is the endodermal. So definitely auditory tube is lined by the, your answer is endoderm. Yes, tympanic recess, again the middle ear cavity is lined by the endoderm. Yes, continuation of this middle ear cavity on the posterior side, that is the mastoid antrum. So you can also say that mastoid antrum. Few books also mentions the mastoid antrum. These all are very close to each other in the same communication. Yes, here is the middle ear cavity communicating with the auditory tube and posteriorly communicating with the mastoid antrum. So these all are derived by the first pouch, so lined by the endoderm. Now the second, yes, the second pouch is making the inner structure inside the oral cavity, that is the palatine tonsil. But remember one update, that actually not the entire palatine tonsil but only the part. Yes, inner epithelial lining is endodermal, while the lymphocyte and the connective tissue, yes, the lymphocyte, connective tissue, these all are the derivative of the neural crest cells according to the recent update. So what you have to remember? Yes, tonsil. What are the tonsil? We will study in the Walder ring. Tonsils are nothing, they are aggregation of the lymphocyte. Yes, these are the aggregation of the lymphocyte. So mainly the tonsil is the lymphocyte and the connective tissue. So tonsil is developing from neural crest cells, and then you will opt the second pouch. So this is your recent update according to the Langemann, Larson's Gray's anatomy. Okay, so now the third pouch, we are talking about the third pouch. It develops into the two part. Yes, dorsal part and another is the ventral part. Yes, see here, the dorsal part makes the parathyroid 3 because it is developing from the third pouch, that's why parathyroid 3, while the ventral part it makes the immune system part, that is the thymus gland. Again the connective tissue of this, all the structures are coming from the neural crest cells.